we've been exploring one particular approach known as pay for success financing. It's a new approach for scaling proven social programs that have proven impacts, but also save government's money. It involves partnerships between private investors, either philanthropic or commercial, the government, which is willing to pay for outcomes when success is achieved, and impartial evaluators who measure the success of the program with the service provider like NFP. And so we're interested in how you can use pay for success financing to really solve a problem for governments, which is money is tied up in remediation and rehabilitation and not invested in prevention that can have long-term benefits.
You know, let me ask you something, because you're using terms that bankers use, that finance people use. You're talking about investment, pay for success. If you're asking for money, are we talking about writing grants and asking for gifts philanthropically, or is this some type of return? Is this a direct return on investment? How does this work?
Well, pay for success is an emerging model. It's an emerging asset that banks are making investments in. Goldman Sachs has made an investment in New York City's Pay for Success project, also known as a social impact bond, focused on the reduction of recidivism. Bank of America has made an investment in New York State's project, which was just announced in the last couple of weeks. We're exploring how this model of pay for success financing is applicable to Nurse Family Partnership in South Carolina. We've done a feasibility study. It's feasible. There's unmet need in South Carolina where we could scale up Nurse Family Partnership if the financing became available. And the state is exploring it. An RFI was released back in September, and that began the explorations on the part of the state.
Okay, so